session. Our next session is going to focus on the power of partnerships, a segue from the last one, especially between public institutions and private actors to drive innovation and financing for more climate-resilient health systems. And to get us started, we'll have some introductory remarks from Matthew Watkins, lead for climate and health at the World Economic Forum. Matthew?
Thank you very much. I'd just like to say that, number one, I'm very pleased to be here at this important session on public and private sectors in sync for resilient health systems. I'm happy to spend a few minutes warming you up for the session, talking a little bit about our experience in working with both the public and private sectors on the urgent need for action, and on some examples of good partnerships that we see with our partners at the World Economic Forum. So I'd just like to start by saying that if you go back 15 years, in terms of my personal experience, at that time, I had just finished medical school in the UK. I was working in a busy district general hospital, and I can tell you this was a very difficult time. This was a tough time for me personally. It was a stressful time, and the UK's National Health Service was extremely stretched at this point. It was extremely under-resourced. And this was back 15 years ago. And I have a significant concern that with the impact of climate change on the burden of disease, the work of health systems all around the world, both at my home in the UK and also in Brazil and in other countries, is going to be severely stretched. And it's a good time now to start thinking about what we can do as a response to this coming crisis. In terms of the role of the private sector, historically the private sector has stepped up at times of crises, particularly in some of the previous climate COPs, and also in terms of biodiversity, in terms of other environmental crises. And I get asked a lot at the moment about the role of the private sector in the current global health system, which has, as everybody is very much well aware of, a significant resource depletion. And I personally believe that the role of the private sector is going to be considerable in the future in terms of mobilizing to provide expertise, resources, innovation, and scale, if we can find the right ways of operating between public and private partners. So I do think that the private sector has a significant role to play in more resilient healthcare systems. With the work of the World Economic Forum on climate and health, we've worked on these three pillars in terms of gathering the evidence base for change, promoting climate and health through advocacy and visibility, and also in terms of incentivizing action both in the public and the private sectors. And I'm just going to spend a couple of minutes revisiting some of the reports that we put out over the past couple of years and pointing to some of the key pieces of evidence that we're really looking to use to drive change. So this is a report that came out in January of last year, and the key figures from this report on quantifying the impact of climate change on human health are in fact rather startling. So we quantified the impact of climate on health at a total cost of $12.5 trillion between now and 2050, and at 14.5 million lives lost over the same period. And this is based on an IPCC scenario of 2.7 degrees of warming. We're currently on course to more significant impacts than represented here. And you can see that this 1.1 trillion figure here is the cost specifically to healthcare systems. For me, it's really important that we work not just with healthcare in the healthcare sector, but we also look to cross-sector partnerships in order to take some of this pressure off healthcare systems. But it's not all just doom and gloom. In our most recent report, we looked at the potential of the life science sector, at life science solutions to reduce some of these negative impacts of climate change on human health. And we believe that these can be reduced through increased innovation and through increased investment by between 21 and 49%. However, in order to do this, we face a huge investment gap. So we face an investment gap of 65 billion over the next 5 to 8 years. And in order to figure out where this is going to come from, we clearly need to work in partnership, bringing in both the public and the private sectors as well. So we really need to think about the role of each of these sectors. We need to work in partnership. We need to think about how we can use catalytic capital to bring in further private sector investment. We need to think about blended finance solutions in order to unlock some of this investment and fill this investment gap. And there are a number of examples of how this has been done in the past. So on this slide, you can see on the left-hand side some of these roadblocks to investment that we know we need to tackle. On the right-hand side, you can see the impact of a previous policy that we reference in our latest report. And this is in relation to the US Orphan Drugs Act of 1983. And this provides a really good example for me of how incentives on the policy side, such as market exclusivity for new drugs for orphan diseases, such as tax credits for clinical trials, such as fee waivers, and access to research grants have in the past been incredibly effective in encouraging private sector investment. And it's this type of policy that I believe can provide a good template for how we can work together, both with policymakers and also bringing in private sector investment to tackle the looming crisis in terms of climate change and health. So those are a few points that I wanted to make in terms of the need for investment, of innovation, particularly with a health sector focus. But as I said right at the start, I also believe that it is critically important to work not just with the healthcare sector, but also with insurance, with food and agriculture, and with stakeholders also from the built environment sector. So as the forum, we're currently compiling a report which will come out at the time of the UN General Assembly in the summer. And we've been speaking with partners from all of these different sectors and understanding how they are working together on climate health resilient solutions. And I'll just share with you a couple of quick examples. So in terms of insurance, we're working with insurance partners that are providing parametric insurance products for agricultural workers, so that agricultural workers don't have to turn up when the temperature exceeds a certain limit, when we're suffering from a heat wave. They're less exposed to extreme heat. We have less people ending up in the hospital at the end of the day. So this is just one example of insurance and agriculture working together. Likewise, in terms of healthcare providers and the built environment sector. So for example, one of our partners working in Western Canada, a few years back now when they had the heat dome around Vancouver and temperatures were 40 degrees for a prolonged period, far more than the region is used to. So this healthcare provider, they worked with the city government in order to get building regulations changed, in order to improve how people could become isolated from the extreme heat within their apartments, within their homes, and become protected from some of the impacts of climate change on their health. Likewise, we can see examples in Europe as well. So again, one of our partners has recently produced a dengue vaccine, which is going to have a significant impact in reducing dengue, one of the vector-borne climate associated diseases, which is of course spread by mosquitoes, whose habitat is increasing with warmer temperatures. So they have this technical solution. They have a vaccine available, but they also found that they needed to work beyond technical solutions. They needed to work in the enabling environment. They needed to work with city planners to reduce mosquito breeding grounds in Spain. So city planners, for example, in Madrid, were able to redesign city drainage systems to reduce the standing water and the habitat that mosquitoes could breed in. So for me, these kinds of cross-sector solutions, working with private sector partners from different sectors and also with public sector partners are really critically important in reducing the pressure on healthcare systems. The final point I wanted to make is that we're very pleased to have seen a proliferation of organizations working on climate and health. But we also believe that we need better connections and better possibilities for working together going forwards. This is why we're working on the CHAMPS tool, the Climate and Health Action Map for Stakeholders tool. And we're asking all of the stakeholders that we work with to fill in a brief survey. And again, later this year, we'll be publishing the results of this survey and asking everybody to contribute to be listed as part of this action map in order to work better together going forwards. So just to conclude, I believe that health systems are going to come under significant pressure, increasing pressure with the impact of climate change on health. That there are solutions available, bringing in private sector partners to work in collaboration with the public sector, particularly in terms of innovation, in terms of investment, but we also need to do a lot better job in maximizing the impact of partnerships both within and also outside of the healthcare sector. I'm very pleased to see the panel today and hand over to colleagues to talk about some of these solutions. So thank you very much.
Thank you for those fantastic remarks, Matt. We will be continuing this conversation on this important topic of cross-sector public-private partnership with a panel moderated by Franciscka Lucien, Senior Director of Health Equity at the Clinton Global Initiative. Please welcome Franciscka and our panelists, Sobel and Gabrielle.
Thank you so much. Before we get started, I just wanted to echo the thanks to Matt for that helpful framing and insights from the global public-private partnership landscape, including solutions that already exist and are being actively implemented. I also want to take a moment to say a huge thank you to the Forecasting Healthy Futures team for organizing this summit, but also inviting the Clinton Global Initiative to co-program this session. We've been grateful to partner with Forecasting Healthy Futures and many of you in this room and others across the global ecosystem on climate health initiatives and are excited for today's conversation around concrete models of public-private partnership that we can hopefully learn from and that offer a roadmap for additional work that can happen over the future. Just to share a little bit about this session before I join the panelists. This session is designed to explore how the public and private sectors can work together, intentionally and sustainably, to accelerate progress on climate-resilient health systems. It's an opportunity to feature practical partnership models and bold new commitments, and to show how existing platforms, like the World Economic Forum, CGI, and many of the platforms that you engage in and steward, can help structure and sustain long-term action. With perspectives from public and private sector stakeholders, this session will highlight two examples of public-private partnership, exploring the future for collaborative healthcare models to scale innovation and align investments with equity, but also support the enabling environments that allow partnerships to thrive. We're here today because of the health consequences of climate change are accelerating and worsening, and no one sector can solve it alone. The public and private sectors each bring distinct strengths, and what we've seen at CGI is that partnerships are the most effective way to get something done. Partnerships can help us move fast enough, boldly enough, and inclusively enough to address climate impacts on health and reduce future risks. And most importantly, partnerships can deliver mutual value when vision, expertise, incentives, and accountability are aligned. So I am excited to join the panelists, Gabrielle Sobel, Global Principal of Climate and Health at Jacobs, and Maria Sol Pintos Castros, Deputy Head of Private Sector at the Global Fund to fight AIDS, TB, and malaria in conversation now. Thank you. Oops. All right. So, Gabrielle and Sol, first question to you. In your work, how have you seen public-private partnerships enhance sustainable healthcare delivery? Perhaps I'll direct that to you.
I can
Sol,
start.
to
I was going to say, shall I start?
Yeah.
So I think, I'm speaking obviously on behalf of the Global Fund, but more generally as I see how it works with private and public. The PPP is fantastic because it brings together the key features of the two sectors, right? Is the scalability of the public sector with the know-how, innovation, speed, acceleration of the private sector. So you bring those two together, you define the clear entry points, you define the areas where those private-public partnerships can have greater impact, and you can have that long-lasting sort of impact, Also, in case of the Global Fund, by engaging communities, right? So these are community-driven interventions that can be brought to the scale because of the public sort of structure with the speed, the delivery, and sort of, the innovation that the private sector brings to the picture.
That's great. And Gabrielle?
Yeah. Well, first, I want to thank CGI for inviting me to the panel and also Forecasting Healthy Futures for convening us in beautiful Rio de Janeiro. And before I answer your question, I just want to give a background on Jacobs because I imagine a lot of folks in the room haven't heard of us. So we are 45,000 people strong and headquartered in Dallas, Texas. We have 400 offices spanning in over 40 countries, and we provide cross-cutting advisory and infrastructure solutions in multiple sectors, including water, transportation, environmental, cities and places, and of course, health. Our health business sees around 80 million US in revenue a year, and we work for-profit or not-for-profit hospitals and health systems, academic medical centers, ministries of health, departments of defense, multilateral banks, and biopharma. At Jacobs, although we do not do patient care, we enable the environment to be able to deliver patient care in 3 key spaces, which is operations, infrastructure, and governance. So some of those capabilities include operational planning, financial and capital advisory, health planning, design and construction, and then global health security, resilience, emergency management, and public health. And our climate work spans all 3 of those areas. And so we bring sustainability and resilient solutions to our health partners, but at the same time, focus on climate change impacts on One Health. So that's animal ecosystem and human health. And so back to your question on how PPPs enhance sustainable healthcare delivery. As you were saying, the public health sector, has a mandate to protect public health, but often lacks the resources, technology, innovative ideas, or rapid deployment to act alone. And so that's where the private sector can come in, bring that innovation and financing, that infrastructure expertise, and the ability to scale solutions quickly. So I'll give an example of a project that we worked on with the National Health Services Scotland to draft their individual net zero carbon roadmaps for 12 of their 22 health boards. And this was to meet their goal of reducing operational greenhouse gas emissions on or before 2040. So our work involved data gathering and creating that carbon emission baseline and their business as usual trajectory out to 2040. We conducted site visits in order to carry out energy efficiency audits. We analyzed decarbonization measures and quantified those residual emissions, did reporting, and of course the final report there, and When we initially proposed on this work, we allocated resources for 4 of their roadmaps over a 3-month time. That's what we proposed on, not expecting the NHS to contract all 12 roadmaps to one firm. And so they came back and wanted us to do all 12 in the same 3-month time frame, and we delivered. And so that mobilization is a unique benefit of working with the private sector. So public and private together can really help build resilient health systems that can withstand and respond to climate shocks.
Thank you so much for that. I'm going to come back to you on a question to get into some of the barriers and solutions more specifically and key takeaways and insights from your work at Jacobs. But first, a question over to Sol at the Global Fund. Sol, earlier this year, the Global Fund launched a new climate health catalytic fund in partnership with Foundation S, the Sanofi Collective, and the Gates Foundation. Could you share a little bit more about the catalytic fund mechanism itself? As a model for public-private partnership, and then, of course, share a little bit about the Climate Health Catalytic Fund in particular.
Yeah, with great pleasure, Franciscka. As you know very well, you know, CGI, very, very happy that the Clinton Global Initiative is also involved and has been involved. So this catalytic fund is being announced as a commitment to action. So we were very pleased to do that. So, but back to how we frame this, and I think this is what I was trying to say before about, you know, really mixing and matching the key features of the two sectors, right? So for us at the Global Fund, I think one of the important things to attract that, to really gather private and philanthropic capital, is to define mechanisms and tools that are very concrete for private and philanthropy to really see where the impact is much relevant and needed. So these catalytic investments really leverage kind of the best features of the two parties. So on one side is the Global Fund, is the scalability, the proven model, the delivery, the very deep in-country partnerships where communities at the forefront really defining what is needed. And then here it comes the private sector with the risk appetite, with the flexible capital, really the risk and investments that can help us accelerate those innovations that we know we can continue to fight these diseases and strengthen health systems. So for us, it's fundamental to have these two together, and this is where the magic match happens, right? So to your point about the Climate and Health Catalytic Fund, we were very proud to launch this. It's the first of its kind fund that is interacting at the intersection of climate and health. It's a $50 million fund that is being launched in partnership with the Gates Foundation and Sanofi Collective, the Foundation S, and with CGI also in the backdrop, helping us to really promote this amazing tool, and really intends to basically mitigate the impacts. So the Global Fund already invests in the 50 most climate-sensitive countries already. So we help countries to build stronger systems, more than $2 billion a year to do that, and 50 of those countries are already hit by climate change in the most hardest way. So this catalytic fund intends to deploy fast financing to help countries to mitigate that impact, but in the longer term is all about the adaptation, the adaptability, how we can help countries to build more resilient health systems. So most of this catalytic fund is in grant funding for countries, but also is technical assistance, because we really want countries to be better prepared to know what to ask and to whom to ask. So we really work closely with the World Bank, with the Green Climate Fund, aligning our systems and processes to make it easier for countries to access climate and health financing. So this catalytic fund, it will touch multiple points that I think is going to be very relevant for the way forward on how investments in health are made through the lens of climate change. Thank you.
Thank you so much for that, Sol. I mean, the Global Fund has been such a leader in the health space and in engaging the private sector in support of global health priorities. But I want to stay on the Catalytic Fund for one more moment. Yep. In our conversation before this panel, you had made this statement that has stuck with me. There you said the Catalytic Fund is a way of de-risking future public contribution. And I'm wondering if you could say a little bit more about that. What does that mean to have a catalytic fund that is financed by the private sector and philanthropy? And then what does that transition look like from the catalytic fund to donor financing of these priorities?
Yes, thanks, Francisca. And this is great, exactly to the point I was making before. This is the only way we can really advance innovations. De-risking investments in areas that we need to prove those concepts for later being embedded in national systems, embedded in the structure of the Global Fund, for example, to really unlock and leverage the additional capital. So this catalytic fund is not a silo on the side structure. This is funding that is embedded into the way the Global Fund operates, right? More than 110 countries, grant funding for lower and middle income countries, so the same process structures, reporting systems. But we know that advancing innovations, it really needs have certain risk appetite. And we also know that we don't do that with taxpayers' money, right? Because we have a baseline that needs to be covered. But once those innovations are proof concepts ready to go, then can be embedded in national systems and they can be absorbed by the larger pool of funds that the Global Fund brings to the picture with, other stakeholders at the table. So
that's fantastic. I'll come back to you on some of the lessons that have emerged from Global Fund's public-private partnership models. But I want to turn it back to you, Gabrielle, in this question of what are some of the significant barriers in preventing effective public-private partnerships to build climate-resilient health systems, and what concrete steps can be taken to overcome them?
Yep, great. The main barrier I want to discuss with this and then elaborate on is a lack of public-private coordination in the health sector. So I spent the beginning of my career in the water sector, and so I'd like to compare and contrast some experiences there to illustrate that point. My background is in water and wastewater, so I spent the first 10 years of my career modeling the sewers and figuring out where the overflows are going to be and then making recommendations to the city of where, how do you fix those? So Jacob sat on the private side, and then our client was the public entities, but we would also be consulting with city mayors and city chief financial officers. And what made this work was how the public entities viewed Jacobs in a trusted advisor capacity. So Sally was just talking about being able to build that trust. We don't have time in the climate space to wait. So for the first part of my career, that's all I knew. My firm had a shared passion with our public client to improve water quality for our community, and the public entity trusted our technical guidance, which ensured this long-term partnership. And I certainly see that in the health sector, but not as much. And so I also want to share another example. This touches, Matthew was talking about the healthcare workforce and the issues we're seeing there. So, imagine a health system has spent time and money in assessing the critical assets across their portfolio, and then their main facilities leader within the organization retires. And this person owned that effort and was moving it forward with whatever private entities they were working with. But what was already going to be sort of this decade-long effort to assess the portfolio, identify critical infrastructure, determine the changes needed, create a business case, put out a request for proposal, design the thing, construct it, is now stalled for potentially years because the public entity has lost the facilities leader with that institutional knowledge who could bring that forward. So if you had that partnership with the private sector, they could help you to step in the interim and lead the effort on the public side, something we called staff augmentation or secondment. They could come in and help you write the job posting to bring in someone more quickly. I could go on, but essentially that public-private partnership is a resilience aspect that needs to be considered in absorbing shocks like turnover. And so One last comparison I want to make between the water and health sector has to do with procurement. In the wastewater world, a public entity is going to post their 5-year capital plan with their projects and the budgets and their anticipated start dates. It's a beautiful thing. And this gives the private sector the necessary planning time to position for that work. So this could mean working with the public entity on better understanding project details to determine if our firm is good for that, is the right fit for that work. It could include evaluating partnerships with other private entities that may fill a certain gap, whether it has to do with expertise or geographic knowledge or scalability. And in the health sector, we don't see that sort of pipeline transparency, so it makes it difficult for the private sector to position. And then if you pile onto that really short, sometimes procurement timelines, you could have a hospital put out a request for proposal to the private sector that has as little as 2 weeks for the deadline. So that's a highly technical and specialized scope of work that you have to turn around in 2 weeks. So all in all, this isn't doing the private sector any favors in terms of putting their best foot forward, but it also hurts the health sector in being able to receive quality work. And so the concrete steps that I would recommend, first, public sector being able to view the private partners as long-term strategic advisors rather than external vendors, which of course that relationship takes time to build. Also, as Matthew had touched on, with the private sector can be relied upon to meet the health workforce gap. And then lastly, public sector should consider increasing pipeline transparency and increasing those procurement timelines.
That's fantastic. Those are really essential key takeaways. Thank you for that. And we'll make sure to sum those up at the end of the session for everybody's awareness. Sol, I do want to turn it back over to you. And I think I'm echoing, making noise with my microphone. My apologies. I do want to turn it back to you. What are some of the lessons that have emerged from Global Fund supported public-private partnerships that we should carry forward?
So maybe I should have started by saying this, private sector is at the core of what we do because it's in our governance. We are a public-private partnership as we were funded back in 2002. I think, and that is kind of the main lesson learned. I think the system, the model of the multi-stakeholder model of the fund, which include private sector, public sector, civil society, technical parties, people living with the diseases, is what it makes the model work so well, because it really embeds into the needs of the country, helping the countries to lead about those solutions, and we help with the financing. So it's more than a financial institution, right? So we love to call ourselves as a locally led movement that is globally sort of connected. So I think that to me is the main kind of lesson learned. The multi-stakeholder is fundamental, and in today's world more than ever, right? So we know that one actor is not able to run or to really deliver that solution, but it's the combination of the expertise and the roles we all play that can make the difference and the long-lasting impact.
I think that's a perfect segue to my next question. Earlier I mentioned that, for us at CGI, we've seen partnerships be truly effective when organizations are able to align not only their vision and their values, but also their incentives and accountability. And so building on that, but also your last comment, Sol, I'm curious, how can stakeholders in public-private partnerships align core business capabilities with public health priorities for long-term success? What does that look like?
So I think in our mind, or in my mind also, it starts with the shared value, right? So where do we see those core capabilities that the private sector brings to the table that are aligned with the health outcomes, and how we can make that match happening more often? So, and the role of institutions like the Global Fund is how we facilitate piece to work or to happen, right? Because we are in touch with in-countries' needs and we understand what is happening. We are helping countries to build those resilient health systems. And we also understand what are the needs and sort of the return on investment that business needs to have. Because let's be honest here, it needs to be a win-win for everyone. So it's a question of facilitating that overlapping between the strengths, the capabilities, the know-how, with the needs that we see in countries and how we can bring those together more rapidly, I guess, and at the scale we need. And in my mind, it's only the private sector that can bring that scale, obviously.
That's great.
Absolutely. And in the private consulting world, we align our core business and expertise around the priorities of our partners, whether they're public or private. So in 2021, Jacobs elevated climate response as one of the 3 core accelerators of our company's strategy. So this was aimed at aligning positive societal impact with long-term business growth. And so this part of the strategy focused on decarbonization, adaptation, resilience, energy transition, and nature-based solutions. And so by aligning our environmental and sustainability priorities with our public and private partners, we actually saw 33% revenue growth from 2022 to 2023 in this space. And last year alone, we sold off our critical mission solutions business so that we could actually focus even more on these environmental and sustainability advisory services. And so this strategic move allowed us to focus on, other areas that were experiencing high growth and demand, like climate response, like data solutions, and broader consulting services.
Yeah, I think that's a very compelling point on the business case for public-private partnerships. The fact that you were able to see, was it 33% revenue growth in just 1 year to the next by aligning your priorities with?
In that space.
In that space.
Yeah.
Okay. Still an important proof point, though, and I think really does underscore that there's not only an impact argument to be made for public-private partnership, but that it is something that makes business sense for private sector companies. We know that there are a lot of great models of public-private partnership out there. We heard some of the solutions from Matthew earlier, but we also know that building out these public-private partnerships take time, they take trust, they require coordination. And so in your experience, what role can platforms and ecosystem building play in turning individual public-private partnerships into broader movements?
So private industry has the resources to be able to pivot and scale quickly during a public health emergency, as we saw with COVID. So not only with financial resources, but also with the expertise required to address critical emerging issues and to provide innovative solutions. So when we're talking about climate resilient health systems, you're looking at convening healthcare architects, engineers, CAD designers, communications specialists, social value and equity experts, sustainability managers, clinical professionals, economists. I could go on, and all of these disciplines are used to working together on the private side to execute those projects.
That's great.
Shall I go?
Yeah.
No, I think the most important thing in our mind is how really do you create those very clear mechanisms that can speak to private and philanthropy. Because on one hand is what we were saying before about do we advance those innovations if we don't have the funding? And in the current context, I'm really thinking more than ever when public funding is going to be so compromised that maybe it's only going to meet the minimum service delivery. So the only way to advance is really, getting the private capital into the picture. So I guess I will say the one solution is let's be clear with the tools we build. Let's be very specific about those mechanisms. Where is the greatest impact? Where is that return on investment that, if you are a business, you need to go to your shareholders and you need to show what is that return on investments. Yes, it's life saves, but it's also the way you create that long-term sustainability, right, for businesses in country. So I would say, clear, greater mechanisms that can allow those investments. And like they can be concrete and measurable, right? So that we can really measure what is the impact and what are the areas that we need to get more investments or not, and really be very strategic, because the funding is reduced. So we need to be much more strategic on how we are going to operate.
That's great. So with those very specific mechanisms and clear and measurable goals, it will enable us to convene stakeholders within the sector, so within the private sector or within the public sector, but also between these two sectors in really effective ways. I think that's the perfect opportunity for us to turn to the very last question before we wrap up. So what's one action, Gabrielle, Sol, I'll start with you actually. What's one action we should prioritize to advance meaningful public-private partnerships for climate and health?
I think bring the stakeholders together. I mean, more integration is fundamental. We kept on saying that there are two worlds, the world of climate and the world of health. Let's bring it together to really create those meaningful opportunities. And I think, speaking from the private side on the climate industry, I feel they have done a better job in expanding beyond their own industry. I think that the health industry is still struggling how we can expand beyond the healthcare industry into creating those meaningful partnerships. So I will say integration, and really be very precise about the 1, 2, 3 tools or mechanisms that your institution can create or help create that can help us to really address and build more resilient climate and health systems.
Absolutely. Great. Fantastic. And Gabrielle?
And I would say the one action would be, communications and advocacy for public health. So just in terms of what everyone in this room can do, advocate for climate impacts on health in your communities, and do that using personal stories within your organizations as well, using relevant business cases to get your point across, depending on who your intended audience is. I feel like people inherently understand that there's a threat, but then we're also still at the point of educating and advocating. And so just want to close with, and these thoughts are my own, but I would be remiss to come all the way to Brazil and not talk about this. We learn in Greta Thunberg's The Climate Book that fossil fuel companies knew decades and decades ago about their major contributions to greenhouse gas emissions and its impact on our health. But they doubled down using big tobacco PR tactics and controlled public perception and bad-talked renewables. And so although we have a climate COP every year, we continue to see these fossil fuel companies walking back their public climate commitments and raking in record profits. And today, fossil fuels, which would be anything coal, oil, or natural gas, makes up 75% of all the greenhouse gases in the world. And so I am hopeful that in Belém, which will be the third climate COP with a dedicated health agenda, that we will see these countries holding fossil fuel companies accountable and demanding energy transition, because our health depends on it. So thanks.
Well, thank you for sharing your personal thoughts. Thank you to both you and Sol to also speaking to public-private partnership models through your professional work. And thank you again to the Forecasting Healthy Futures team for inviting us to this year's Global Summit and to today's panel session. Thank you very much.
Thank you.
All right.